Have you ever stopped to think that something as ordinary as your daily habits could be quietly putting your life at risk, especially after the age of 70? With time, our bodies change in ways we don't always notice, making us more vulnerable to certain threats. Many assume that sudden death is just bad luck or fate, but in reality, there are specific triggers that make it far more likely. And here's the unsettling truth. Most of these dangers give little to no warning before striking. In this video, we're shining a light on 5 hidden threats that can take even healthy, active seniors by surprise. These aren't random health issues, they're proven, high-risk factors that often disguise themselves as harmless problems or everyday inconveniences. From silent heart problems to routine habits you might never think twice about, each one can lead to a deadly emergency if ignored. Imagine going about your day reading the morning paper, tending to your garden, or enjoying a quiet afternoon when suddenly your body gives way without explanation. No dramatic symptoms, no loud alarms, just a subtle shift that turns into a life-threatening emergency in minutes. That's how sneaky these triggers can be, and why knowing them ahead of time could make all the difference. The best part? Knowledge is your greatest defense. Once you understand these 5 triggers, you'll be better equipped to spot them early, take preventive action, and give yourself the best chance in a long, healthy life. Stay with me until the end, because what you learn today could literally save your life or the life of someone you love. And before we dive in, make sure you hit that subscribe button and turn on the notification bell so you never miss vital health tips like these. Your next video could be the one that saves a life, maybe even yours. Now, let's get started. Number 1. Silent heart attacks. Among the hidden dangers that can strike after 70, one of the most alarming is the silent heart attack, an event that damages the heart without the drama or obvious warning signs most people expect. In movies, a heart attack might be shown as someone gasping for air, clutching their chest, and collapsing. In reality, many occur quietly, with symptoms so mild they're often mistaken for something entirely different, like indigestion, a pulled muscle, or even a bad night's sleep. The trouble is, when the signs are this subtle, people often go about their day without realizing their heart is under serious stress. By the time the truth comes out, the damage may already be permanent. Take Eleanor, a 76-year-old who prided herself on staying active. One afternoon, she noticed a strange heaviness in her shoulders and a bit of nausea after gardening. Thinking it was just the heat, she rested for a while and continued with her chores. What she didn't know was that a small artery in her heart had been blocked for hours. Without the sharp stabbing pain she thought heart attacks required, she never considered calling for help. Weeks later, a routine checkup revealed she had scar tissue from an undiagnosed heart attack damage that had quietly weakened her heart's ability to pump efficiently. Silent heart attacks occur when blood flow to the heart muscle is disrupted, but the symptoms are disguised as something minor. Instead of crushing chest pain, you might feel discomfort in your back, jaw, arms, or upper abdomen. Some people experience dizziness, unusual exhaustion, or mild shortness of breath. Because these symptoms don't match the classic heart attack picture, they're often ignored, giving the heart attack time to cause lasting harm. The greatest danger lies in what comes next. If your heart has already been weakened by a silent event, the risk of a fatal second heart attack rises sharply. Many people only learn about the first attack after undergoing an EKG for another resonance, after a sudden collapse forces them into emergency care. This is why paying attention to subtle changes in your body is essential, especially as you age. If you feel unexplained fatigue, persistent upper body discomfort, or shortness of breath without clear cause, it's worth seeing a doctor immediately. Simple tests can detect heart damage before it becomes life-threatening, giving you a chance to take preventive steps. Even more importantly, lifestyle changes like maintaining a healthy diet, staying active, managing stress, and regularly monitoring blood pressure and cholesterol can dramatically reduce the risk of both silent, quote, and obvious heart attacks. In many cases, prevention isn't just about avoiding a major emergency, it's about protecting the quality and length of your life. Number 2. Postural hypotension and falls. It might seem harmless, a brief wave of dizziness when you stand up. But after 70, that fleeting sensation can be the start of something far more dangerous. This condition, called postural hypotension, happens when your blood pressure drops suddenly as you rise from a sitting or lying position. For younger people, it might mean a quick pause before walking. For older adults, it can mean an unexpected fall, a serious injury, and a long road to recovery that sometimes never fully ends. The real danger is that many seniors don't see it coming. One moment, you're fine, the next, the room tilts and your balance is gone. Consider Irene, a 79-year-old who loved tending to her flowers every morning. One day, she bent down to water her roses, and when she stood up, her vision blurred and her knees wobbled. She tried to grab the edge of a chair, but her hands missed. In seconds, she was on the ground. The fall fractured her pelvis, leading to surgery, weeks of bed rest, and eventually, a loss of confidence in walking alone. A single dizzy spell had stolen her independence. Here is the truth. Most falls that cause life-changing injuries in older adults don't come from a dramatic accident. They start with something small, like a moment of dizziness that's ignored. Postural hypotension is not just part of getting older. It's a warning sign that your body needs help. And when that warning goes unheeded, the price can be devastating. Postural hypotension is more common with age because the body becomes slower at regulating blood pressure during sudden position changes. The heart may pump less efficiently, blood vessels may be less responsive, and factors like dehydration, certain medications, or chronic illnesses can make the drop more pronounced. That's why some seniors feel perfectly fine sitting down, but experience sudden lightheadedness the moment they stand. The consequences go far beyond the initial fall. Hip or pelvic fractures often lead to reduced mobility, which in turn weakens muscles, raises the risk of blood clots, and makes infections more likely. Even after physical recovery, the fear of falling again can limit daily activities, leading to isolation and depression. In this way, one fall can set off a chain of events that deeply impacts quality of life. The worst part? It can happen without warning. A conversation at the dinner table, a quick trip to answer the phone, or getting out of bed in the morning can all be moments when the drop in blood pressure strikes. But with awareness and small adjustments, such as rising slowly, staying well hydrated, wearing supportive footwear, and reviewing medications with your doctor, you can greatly reduce the risk. Your body sends signals for a reason. If you notice dizziness, blurred vision, or weakness when standing, don't shrug it off. Addressing postural hypotension early can prevent the type of accident that changes everything in a heartbeat and safeguard the independence you've worked so hard to keep. If you've ever experienced these symptoms, speak with your doctor this week. Share this information with a friend or loved one. It could save their life. And if you want more practical health tips like this, hit the subscribe button, turn on notifications, and let's keep learning how to stay strong, safe, and independent together. Number 3. Hidden blood clots, deep vein thrombosis. Many people imagine blood clots as something that only happens in extreme medical causes after major surgery, a long hospital stay, or an injury. But in reality, clots can form quietly in the deep veins of your legs during everyday life, often without dramatic symptoms. When one of these clots breaks free and travels to the lungs, it can cause a pulmonary embolism, a sudden, life-threatening blockage. This is why deep vein thrombosis, or DVT, is often called the silent killer. It develops slowly, hides in plain sight, and can strike without a second's warning. Consider Martin, a 77-year-old who enjoyed playing chess online and could sit for hours completely absorbed in a match. One evening, after a particularly long game, he noticed a bit of swelling in his right calf. It wasn't painful, just a little puffiness that he assumed came from sitting too long. A few days later, he experienced shortness of breath and mild chest discomfort, but brushed it off as fatigue. The truth was far more dangerous. A clot had formed in his leg, and it was only a matter of time before it became a deadly emergency. Here is the truth. DVT doesn't just affect people who are bedridden or seriously ill. It can happen to anyone, even those who believe they are active enough. Long stretches of sitting, whether in a recliner, at a desk, behind the wheel, or during a long flight, can slow blood circulation in the legs, creating the perfect conditions for a clot to form. The warning signs are subtle: mild swelling, slight tenderness, a warm patch of skin, or a cramp that feels like a pulled muscle. Many ignore these symptoms, only realizing the danger when it's too late. Older adults face higher risk because circulation naturally slows with age, and underlying conditions like heart disease, diabetes, and high blood pressure can compound the problem. Medications such as hormone therapy, certain blood pressure drugs, or cholesterol-lowering prescriptions can also affect clotting. Add in dehydration, which thickens the blood, and you have a hidden but deadly recipe for trouble. The danger is magnified when a clot dislodges and travels through the bloodstream to the lungs. In an instant, it can block oxygen flow, causing sudden collapse or death. Many victims never even realize they had a clot until it's too late. That's why awareness and prevention are critical. Once a pulmonary embolism occurs, survival depends on immediate emergency treatment. The best way to fight DVT is to keep your blood moving. If you're sitting for long periods, stand up and stretch every hour. Rotate your ankles, flex your feet, and avoid crossing your legs for extended times. Stay hydrated throughout the day and consider compression socks if you have poor circulation. Most importantly, never ignore unexplained swelling, redness, warmth, or pain in the leg. Get it checked by a medical professional immediately. And remember, prevention is always easier than emergency treatment. Simple daily habits can drastically lower your risk, protect your circulation, and save your life. Share this knowledge with your loved ones. Never know whose life it might change. Number 4. Hidden infections that turn deadly. One of the most underestimated dangers for people over 70 isn't always something dramatic like a stroke or a sudden collapse. It's a quiet, slow-moving threat, an infection that seems minor but turns into a dangerous condition called sepsis. Sepsis happens when the body's defense system overreacts to an infection, causing widespread inflammation that damages organs and can lead to death. What makes it so frightening is how easily it hides in plain sight, often starting with symptoms so mild they're mistaken for everyday fatigue or a common cold. Take Arthur, a 76-year-old retired teacher. One winter morning, he notices a persistent cough and a slight shortness of breath. Assuming it's just the weather, he drinks tea, rests, and waits for it to pass. Within days, his breathing worsens, he develops chills, and his speech becomes slightly slurred. By the time his neighbor finds him disoriented on the couch, the pneumonia he ignored has spread to his bloodstream. The hospital team acts fast, but the infection is already overwhelming his system. The reality is, infections like pneumonia, urinary tract infections, or even a tiny skin injury can quickly spiral out of control in older adults. As we age, our immune system weakens, making it easier for bacteria to spread and harder for the body to mount a strong defense. To visualize this, imagine your body as a city protected by walls and guards. When you're young, the guards are alert, swift, and strong, ready to repel invaders. But with age, the guards become fewer, slower, and less organized. A small group of intruders can slip past without much resistance, and before you know it, they've taken over the entire city. This is exactly how a seemingly harmless infection can overpower an older body before help arrives. The challenge is that early symptoms of sepsis, mild fever, tiredness, confusion are easy to brush off. Many seniors think they just need a little rest, not realizing every hour without treatment allows the condition to worsen. If it progresses, sepsis can cause blood pressure to drop dangerously low, leading to multiple organ failure. In its most aggressive form, it can take a healthy person from mild illness to critical condition in a single day. The best defense is vigilance and quick action. Even if a fever or cough seems minor, it's safer to have it checked by a healthcare professional. Sudden confusion, rapid breathing, intense weakness, or chills are signs that medical attention is needed immediately. Family members and caregivers should also be alert to these signals because sometimes the person affected may not recognize how serious things are becoming. Acting fast can mean the difference between a full recovery and a life-threatening emergency. If you're still reading this and finding the information valuable, type number 4 in the comments. And if you haven't already, subscribe and turn on notifications so you don't miss the next life-saving insight we share. Number 5. The hidden danger of medication mistakes. For many people over 70, the greatest health risk isn't an infection or a sudden fall, it's a danger sitting quietly in the medicine cabinet. Medication mistakes, whether it's taking the wrong dose, skipping a pill, or unknowingly mixing drugs that clash, can trigger life-threatening complications such as strokes, heart failure, or severe internal bleeding. What makes this risk so concerning is that it often goes unnoticed until it's too late. Many seniors believe they're managing their prescriptions well, only to find themselves in a medical crisis after a simple oversight. Take George, a 78-year-old who carefully follows his daily medication routine. One weekend, after experiencing severe indigestion, he takes a common antacid without realizing it interferes with the absorption of his heart medication. A few days later, he feels dizzy and short of breath. By the time he's taken to the hospital, his heart rhythm has become dangerously unstable, a direct result of the drug interaction. As the body ages, it processes medications more slowly. The liver and kidneys responsible for breaking down and removing drugs can't work as efficiently as they once did, allowing medications to linger in the system. Even doses that were safe years ago can become harmful, and combining the wrong drugs, whether prescription, over-the-counter, or herbal, can cause sudden and severe health events. Another overlooked hazard is pill overload. Many seniors manage multiple chronic conditions and end up taking a mix of medications with complex schedules. Some require food, others an empty stomach. Some must be spaced hours apart to avoid interference. Missing a single dose of certain drugs, like those for the heart or blood sugar control, can be just as dangerous as taking too much. To better picture it, imagine your body as a delicate chemical balance, each medication, like a carefully measured drop of dye in a glass of water. Add too much of one, skip another, or mix two that shouldn't be together, and the entire balance is thrown off, sometimes beyond repair. This is how small mistakes can lead to big emergencies. Prevention starts with awareness and organization. Keep an up-to-date list of every medication you take, including vitamins and supplements, and share it with every healthcare provider you see. Use a clearly labeled pill organizer or set phone alarms to ensure you take the right dose at the right time. Never assume an over-the-counter medicine is safe just because it's common. Always check with your doctor or pharmacist. Even the smallest lapse in medication management can cause irreversible harm. By staying vigilant, communicating openly with healthcare providers, and taking a proactive approach, you can greatly reduce the risks and protect both your health and independence. We've now covered 5 often overlooked health dangers that can lead to sudden death after the age of 70. Take a moment to think about which of these might be relevant to you or someone close to you. As we get older, certain parts of our health can become surprisingly vulnerable, and the greatest threats are often the ones we barely notice until they cause serious harm. The encouraging part is that awareness changes everything. Maybe you felt a quick wave of dizziness when getting out of bed and dismissed it. Or perhaps you've noticed mild swelling in a foot or leg and assumed it was nothing more than sitting too long. These subtle signs matter. Simple adjustments like rising slowly, drinking enough water, or adding light movement to your daily routine can make a real difference in keeping you safe. For those taking medications, checking dosages, schedules, and potential drug interactions is one of the easiest yet most effective ways to reduce serious health risks. The purpose of this discussion isn't to frighten you, it's to give you tools and knowledge so you can take control of your well-being. The more you understand these silent dangers, the better equipped you are to prevent them. Small, consistent actions like recognizing early signs of heart trouble, seeking help quickly for infections, or taking steps to avoid falls can extend not just your years, but your quality of life. Being proactive about your health isn't only about staying safe. It's about preserving the freedom to spend meaningful time with family, pursue hobbies, and enjoy the moments that matter most. We appreciate you being here today. Tell us in the comments one insight you're taking away and how you plan to apply it in your own life. Your thoughts matter, and hearing from you inspires us to keep sharing life-saving information. If this content was helpful, We'd love for you to like, subscribe, and share it with others. Your support helps us continue producing valuable and inspiring content for our community. Thank you for watching, and we look forward to having you with us again in the next video.